Share with us a little bit about what are some of the best ways in which you see offshoring working in medical practices.
Yes. So I think it really started with scribes. Scribing seemed to be, it's a specialized area. You need to have enough medical knowledge. And so really saw it take off in that. We're starting to see that be really replaced by AI and, DAX Copilot and things. And so now we're seeing a lot more people look at things like medical records, prior authorizations, if you do any patient recall outreach sort of stuff. That has to go out.
Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice.
Hello, everyone. Welcome to Medical Money Matters. I am joined today by Josie Van Scholten of Valenta. She is the managing partner there. Valenta is a global company that offers AI and offshoring services. Josie is a recovering healthcare administrator with many, many years of experience running private practices throughout the region. So, Josie, welcome. Glad to have you here today.
Thank you. My pleasure.
And so I'm excited to jump into this whole topic with you. We're going to focus mostly today on the questions around offshoring employees, as I know that's of huge interest to our audience. And we're also going to kind of dip our toe in the water a little bit around the AI and the robotic process automation. So I'm very excited about it. But I'd love to start with just having you walk our audience through the basic mechanics of offshoring employees.
You bet. It's actually very straightforward and really simple. Once you pick a company and you talk to your account person about what your needs are, what sort of position you're looking for, we would ask you, kind of specific tasks, qualities that you're looking for. We would talk about the different options that we had available. I know we're going to talk about this a little bit later, but we do have, as a global company, we do have staffing, all over the world, and we would help you narrow down where we're going to look for employees. We would send you CVs to look at. We set up interviews for anyone you're interested in talking with, and we would also walk you through, usually they can be, we'll try to help you with people who are available right away, but we will also, if somebody's available in a few weeks or a month, we would let you know what the timeline is going to be and help you with that transition. And you sign a contract and you pay a monthly fee and you're off and running.
The races. Yeah. Well, you make it sound really easy. I love that. Thanks for simplifying. That's so great. Share with us a little bit about what are some of the best ways in which you see offshoring working in medical practices.
Yes. So I think it really started with scribes. Scribing seemed to be, it's a specialized area. You need to have enough medical knowledge. And so really saw it take off in that. We're starting to see that be really replaced by AI and DAX Copilot and things. And so now we're seeing a lot more people look at things like medical records, prior authorizations, if you do any patient recall outreach sort of stuff, that has to go out. We've actually even seen people use, set up a monitor at the check-in process to have a remote worker from, say, Colombia who speaks Spanish help with that check-in process. I mean, you don't typically replace your entire check-in process. I mean, all of these, again, we'll continue to talk about this a little bit more. It's not so much, replacing your whole department, but supplementing it has worked really well.
Yeah, I could see that as being a really great augmentation solution with so many groups that we talk to that are still struggling to fully staff after the pandemic. I mean, It just seems like this is a 4-year-old problem. And it's not getting solved anytime soon. So yeah. So you started to talk about positions. What types of positions in clinics do you see that offshore employees best used in?
So it's really best to take a look at your job description and think about what are the tasks that you really need someone in person and readily available, and what are the tasks that are really, repetitive, routine, that don't require in-person communication. I will say most of these employees do kind of become part of the staff. They join your teams or your Slack or whatever your method of communication is, and they really can become part of the team. But certainly for anything that involves patient interaction is best for an onshore employee, in-person employee. But anything that's really just, navigating the computer,
And yeah.
maybe, I know a lot of companies use a third party patient intake system, that maybe doesn't necessarily, unfortunately, fully integrate with their EMR. And
Yeah.
so if you're having people just transfer data, I mean, that's something an offshore person or a computer bot can do.
Yeah.
And so it can reduce errors, and, really saving your onshore employees for where are the problems, where are the unusual cases, where are the exceptions. Those are the people you want to, just like we always talk about in medical, having, your clinicians work to the highest level of their licensure.
Yeah.
I think this applies, I mean, not that you have a licensure, but it applies in administration as well, that, especially if your employees are feeling stressed or like they have too much to do, really getting them help. This is a good way to do that.
Well, and keeping, like you say, keeping those onshore employees is they're a valuable resource, and keeping them in those
Yes.
patient-facing roles, where it's, the human touch is really important. So,
Absolutely. And I know, especially with independent, smaller practices, that's so much what patients value, is that they know who to call in the billing office or medical records, or, they appreciate that extra touch, and you don't have to get rid of that,
right.
But if you are having trouble finding additional help, rather, I've seen a lot of organizations, a medical records clerk is a medical records person. We all do the same thing.
Yeah.
Or this department has their medical records person, and really you would be better off, putting your most senior person in kind of that traffic control position, if you will, that they're helping organize where stuff goes. And then, offshore or a bot can just do the routine imaging. All goes here. It's, processed this way over and over again.
There are so many repetitive tasks. You and I both know that. So that's a great segue for us to talk. I know Valenta offers, alongside the offshoring, you also offer some AI and robotic process automation, or RPA, for the people that know the acronyms.
Yes.
That you have those solutions too. So talk a little bit about that, like with your clinic administrator hat on for a minute. How would you determine, which is best used where and at what volumes? It makes the most sense.
Absolutely. So for the really small clinics, just, one or two doc, the RPA is still going to be out of reach. You're really looking at 3,000 to 5,000 a month. That's kind of the equivalent of a $17 hour employee before benefits, or a $28 employee before benefits. Definitely the benefit of a bot is that it can do more than one process. So it could run, routine processes. It could post payments for you and help out your billers, and it could process medical records. It doesn't have to just one, it could kind of become the helper for multiple departments.
Yeah.
And you can sometimes, get a really good ROI that way if you're replacing, multiple positions that you're struggling with. But for the smaller clinics, it's really going to be the offshore, where you can get an employee for $1,600, which is about $9 an hour before benefits, to $2,200, which is, just under 13.
Yeah.
Like I said, unfortunately, the RPA is really kind of out of reach for the small clinics at
The
this
smaller
point.
groups, yeah. And as we're leaning toward more medium-sized groups, then what size groups do you see really making good use of RPA?
Anywhere, I mean, I've even seen some that are only, 7 or 9 physician groups, which I would say really is not, definitely if you have, 15, 20, 30,
Yeah.
those could definitely benefit. I think the ones that I've talked to that, were around 7, it was for things like referrals that they had, their nurses reviewing referrals to see if they were appropriate.
Yeah.
And so it kind of became even, I don't care what the cost is. I need my nurses happy and I need them feeling, not overwhelmed.
Yeah.
And anything that I can take off their plate to keep them happy, I'm willing to do.
Absolutely. Well, that's key too. I tend to think about this. Obviously, it's medical money matters, so I tend to think about the
Right.
money and the finances first. But you make a very valuable point that sometimes the reason for adding these kind of resources is retention of your current team
Right.
and team happiness. Yeah, that's
Yeah.
always a good story. So
Because I think, we've definitely seen a lot of practices really struggle with these entry level positions,
mhm,
which again, where, offshore and RPA is really great for. I really encourage to people to think about, the toll it takes on kind of your superstars in those areas to always be retraining, to be filling the gaps, having to be doing extra work,
yeah.
to kind of hold things together while you're trying kind of employee after employee.
Yeah.
I think it could potentially get really scary if you're starting to lose some of those longtime employees that you really depend on.
Yeah, absolutely. Well, and I think that's a little bit of a sidebar and a tangent, but and probably a good idea for a future episode is just truly understanding the cost of turnover. I think
Yeah.
it's very easy for any organization, clinics or otherwise, to underestimate that. If you have a $25 an hour employee leave, we kind of feel like, oh well, you don't pay their salary for a few weeks and we hire somebody new, and we don't
Right.
we continue to kind of forget to count in like all the overtime that you may have had to pay in the interim, and the recruiting costs and the cost to get them up to speed and retrain and all of that. So
Well, and
um,
potential errors. I mean, certainly in medical records, errors can be scary.
yes, exactly. Well, yeah, errors anywhere in a clinic can be a little scary, but
Yeah.
well, that's probably a good segue. We talked about, would we talk about a horror story or a funny story? And I think you decided you were going to share a funny story about
Right.
offshoring. So I'd love to hear it.
Yeah. I think it's more just kind of about the human aspect of it. That I think, one clinic I was working with, they were just so surprised to learn that, this nurse they were working with in the Philippines, really valued her job with them because, the patient ratio, how many patients nurses were expected to take care of in her home country, was
Mhm.
just really overwhelming and stressful. And so even though she was having to work nights,
Mhm.
that this job was less stressful to her.
Wow.
And so
Wow.
that was
Yeah, we don't
interesting.
think about that a lot. Like
Mhm,
what's the career alternative?
mhm.
And yeah, where we think, a census here is pretty high. Yeah, not unusual to see those doubled, tripled, quadrupled in other places. Yeah, where that
Yeah,
expectation. So yeah, thinking a little bit about, yeah, elevating their professional experience, and they're allowing them to keep some sanity in
yeah.
what they're doing. So yeah.
Well, and actually, I'd be curious what, some of the other companies like HelloRach and, you
Yeah.
know, Mountain Movers and stuff are seeing, but at Valenta, we are seeing kind of, wages also start to rise. It's harder to find a nurse at that 1,600 level from the
Yeah.
Philippines.
Yeah.
As demand increases, then
There's the basics of
oh,
supply and demand, right? Yeah,
yes,
it's going to be
yes,
yeah.
yeah,
Yeah. So, well, that's good. That's good. It's sort of like, hey, folks, if you're thinking about offshoring, now is a good time to
right,
think about it,
right.
because yeah, the global markets are going to shift. So,
Mhm.
and that's a really great lead in. I know you've said Valenta is a global company. and that you employ all of the people directly. So maybe talk a little bit about the pros and cons of that, because I know other outsourcing or offshoring companies don't. They act as a broker or something for people. And then also maybe touch a little bit on the different areas of the world, like you mentioned Colombia and also the Philippines, where you have folks that work for you.
Yeah. For me, it's really great because I have my contact in India, Devinder. He's our medical person. And,
Uh-huh.
I just teams him and say, hey, I'm talking to a client. They're interested in this.
Mm-hmm.
What do you have? So that I can even, walk into a meeting with, here's some examples of the people we have right now who are available.
Mm-hmm.
But of course, if we don't have exactly what somebody's looking for, then we will go out and hire, and it may take a little bit more time.
Yeah.
But I think it's just really, I can trust him to tell me, who's a good person, who's going to be a good match for what types of roles. Sometimes he'll even say, hey, I've got this person with these qualifications. Do you have anybody coming up, that,
Got it. Yeah. So that's some nice back and forth. How
Mhm.
about a little compare and contrast of the various different regions in the world? And if you see people lining up for, fitting better for different positions based on
Mhm.
where they are.
Yeah. So Philippines has really been super popular for medical because they do have a lot of RNs. They speak
Yeah.
English,
Yeah.
English kind of as a primary language in school,
Yeah.
and they're willing to work nights.
Yeah.
So um, with India, we are seeing, like I said, I feel like the prices are kind of rising
Yeah.
as demand has increased
Man.
for the
Yeah.
Philippines.
Yeah.
India still has, a large workforce. They know English really well, but the
Mhm.
accent can be an issue, especially like scribing or any type of, um, you know, direct interaction.
Patient facing.
Um,
Yeah.
yes,
Yeah.
but they can be great with, if you patient recalls or some sort of routine. They do a lot of even bookkeeping
Okay.
tasks.
Great.
And then Colombia and other, Central and South American countries. Obviously, the Spanish piece can be a huge
Very useful. Yeah. Yeah.
benefit.
Yeah.
Yeah, for either patient registration or at Valenta, we have a lot of data analytics people in
Mhm.
Colombia, but I know that's not
Mhm.
exactly what we're talking about. But that's
Some of the medium and large size clinics may have need for that
yeah,
now,
yeah,
or maybe they hadn't considered that they have need for that until there's a resource that's available at a better price. So,
right, yeah.
yeah, yeah, that's great. That's great. Well, how about the finances about that? Talk a little bit about how much a clinic can expect to save if they're going to utilize an offshore employee.
Yeah. So, if you have a role that works well and can find someone at that 16, I mean, I think most people advertise 1600.
Sure. Yeah.
That's kind of the,
That's sexy,
so
right? Yeah.
yeah. So that's 9.25 an hour. If you're comparing to say
Yeah.
an $18 an hour employee, you're going to save 18,000 a year, and that's before benefits and taxes.
Yeah.
Because you
Yeah.
don't pay any benefits or taxes on these
Mhm.
employees.
Mhm.
If it's a 2,200 amount, then
Yeah.
you'll probably save about 11,000 a
Yeah.
year before.
Yeah,
Yeah.
absolutely. Well, and that's comparing to $18 an hour. I think I hope,
Mhm.
and this is a broad generalization because our audience is all over the country, but
Right.
I hope most of our listeners are paying more than $18 an hour for their frontline folks. I know our team, we've actually set a company wide minimum wage of $20 an hour, and I think we need to
Wow.
increase that
Yeah.
probably, just to talk about what's a living wage for folks
Yeah.
and. Really to be to be an employer that's fair and reasonable,
Mhm.
folks, and not exploiting people here. I frequently refer in our physician leadership project course to $18 an hour is barely above the federal poverty level for
Mhm.
full
Yeah.
time, and you're trying to support a family on that. So that sometimes putting it in that context kind of helps when we're making business decisions about at what level we're going to hire
Yeah.
and where we're going to hire. But yeah, I think about both. If you're looking at offshoring, the cost savings, but also potentially if you just have the same spend, you're getting two people, or maybe even three for the price of one onshore employee. So that's an interesting way to think about it too, sort of increasing your efficiency and really stepping up the productivity of whatever task it is that you need done.
Whether it be a bot or another employee, again, bot can do multiple
a lot of things.
Processes.
So thinking about the world in terms of bots, in your experience, what's the maximum number of people you've seen replaced by one bot? Just so we have that in our head.
I don't know that I have a set person, a number of FTE. I've seen one bot run 30 to 40 processes. I think it gets difficult to kill the FTE at that point because you're taking parts of so many different, it's like 0.25 here, 0.5 here, 1, here. We typically help people try and pick, what's the process where you're going to get your biggest ROI to kind of pay for get over that hump. If you have 2 or 3 people posting payments, if you have, 5 people in medical records, we can definitely easily pay for that bot. And then it becomes, because you're just paying a setup fee for any additional process. Then it becomes more like a little luxury, making our lives a little bit easier. You're looking at areas where maybe you have potential error rates. You can also start looking at clinical staff, that maybe even, I remember a physician telling me he had 27 clicks to set up a referral, that.
And
can you make people's lives easier?
Automate
and
that?
Focus on patients.
Well, all those replicable processes that we do over and over all day long that we don't think about. And I love hearing that. I'm old enough to have lived through the EMR implementations, in the early 2000s. And, we got really good at counting clicks. That was how many clicks does it take? And every now and then I still hear that. So that's a great thing is for our listeners. Think about areas where you have a large number of clicks to do the same thing, all day, every day. You might be doing it 8 or 10 or 12 times a day based on whatever patients you're seeing. Are those processes? So that's fascinating. I'm like beginning to expand my thinking about RPA and what it might do for us. It takes a little something to like get out of your own daily workflow though, right? Because the mouse is just so automatic and we just go, click, 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 and there we go. But to stop and think about what you're doing and is it replicable and something that you could that you could pull out. Well, how about some common pitfalls as people are looking to offshore or use AI or RPA? Where do you see that maybe not working so well?
So I think definitely, especially, if you're looking at employees from India or sometimes Colombia, the language barrier, their accents can be, if they have to interact. And it depends on the onshore employee that's going to be working with them too, that, perhaps it's somebody who it doesn't faze them, they easily understand, or it could be someone where like, it's really a struggle for me to understand, and so thinking about that, interestingly, like in India, they have laws where employees are required to have 18 days vacation a year. So I've just seen some administrators be surprised by that and like, oh wait, what happens when my employees find out that this person has so many more vacation, that just thinking through things are not going to be the same. They aren't making the same, their benefit package isn't the same. So I think just kind of being a little bit aware of that. Some programs like Epic has some limitations regarding the roles that you're allowed to offshore for. So doing your research there and
good. I find that fascinating. Slight tangent for a minute. That there is that concern about, we have federal HIPAA laws in the U.S. The HITECH Act governs all of this.
My next one.
And so then there's always this kind of question floating around about, well, if people are offshore, are they bound by those U.S. laws? And what makes me giggle about those questions is that I know that all of the health insurance companies are utilizing offshore people that are all over the PHI. So that question always makes me giggle a little bit. Like, really? Okay, we're going to get worried about. How do you respond to that one when that comes up?
So HIPAA is important. It's an important question to ask. Certainly, for example, I think in the early days, the Wild West days, before it became more standard, scribes would record. Because then that would help them finish up the patient note, making sure that they're not using any other software tools besides your own.
Okay.
And the business associate agreement with the organization, and
that's key.
Those are the best practices.
I've been in conversation with a few physicians lately. That's probably yet another podcast episode. I got to write these ideas down, right?
Right.
The why would you want to be AA? And what is it? And what is it? How does it protect the clinic? So that's I usually say to our clients, we're executing a standard boilerplate CMS BAA right off their website. So everybody, you can download a standard business associates agreement right off of cms.gov. So it's not hard to find. And that it really does provide some protection for the clinic. And so I always say that to our clients. We're executing this. It's really for you. But we want to make sure we have good business processes. But that's a great tip for any clinic looking to add an offshore employee. They absolutely need BAAs. And if Valenta is going to be creating an AI or RPA for a clinic, they're likely to be in databases where there's PHI. So good ideas on both counts. Well, a little bit of a tangential question, but this one always niggles for me in the back of my mind when I think about the potential to hire offshore employees. From a human standpoint, I get a little concerned about possible exploitation of someone in another country. So you and I talked about this a little bit before we hopped on here. So wander through that a little bit.
Like I said, I think it depends on the situation. And I think a lot of U.S. employers are finding out that, like in the case of India, that, oh, wow, they may actually have more vacation than we do. They may get more time.
There might be a hint buried in there somewhere. Huh?
Right. Or my example earlier, learning from the Philippines that, the patient load is just so heavy that a lot of people decide that, even though they have to work nights, that this is, a better option for them. Also, as we mentioned, just kind of that changing supply and demand. As demand goes up, obviously those wages go up as well. So, and then I think another thing that's interesting is just, I think administrators should be aware, especially, after the election, it seems like it's clear that a lot of Americans feel that immigration or globalization has held down U.S. wages or made things harder for U.S. workers. And so I think it's important to be sensitive to that. You certainly wouldn't want to come across as, our intention is to replace this entire department because we can get you for cheaper. That's probably not going to go over very well, or build morale, or, if your intention is, hey, we've been posting and posting and posting for this position, and we're trying and we can't find someone, and we're burning out people and we're stressing out our existing people, and we want to provide you help, and here's an option. I think that's a very different message. And I think people should be aware of that.
That's great advice, Josie. I love that. And I think your sensitivity is well placed. There's been a lot of conversation about that too. So that's fantastic.
And, the truth, it's also with automation, that automation is a great thing, but automation can replace jobs too. And so I think, we'll talk about this more, but, picking departments where you're struggling to find people rather than picking departments where you have longtime great employees, thinking about where you start.
That's a great one. Well, that's an excellent lead in to if any of our listeners are interested in exploring offshoring and or AI and RPA, what's the best way for them to start?
Well, do your due diligence. There's a lot of different companies out there with a lot of great information on websites. I encourage you to check out the Valenta.io website. I think that's a good place to kind of start and get some ideas. And I'm sure anyone would be happy to talk to you. There's a lot of great resources out there, but
well, your point is well made. Like, really think strategically about where's the best place to start in the clinic, and like you said, that the hint might be where we've had jobs posted that we just can't fill, or departments where we can't retain people. Yeah, where we've just had a lot of turnover.
And I would look at the person you're working with in that organization. My specialization is healthcare. I worked in the healthcare industry. I think that's where I can help, like you said, identify these pitfalls or workflows that make sense and help advise my clients and work with them. Is probably another thing to be aware of.
Well, looking for companies that have a specialization in healthcare for sure. And I would say probably even further in outpatient medicine, like you do. There's a lot of offshoring going on, hospitals, like you said, scribes, kind of a different role. And so someone with your operational background is great. And for everyone, we'll have all of Josie's contact information in the show notes. So you can find her. So that's a great way to ask my favorite wrap-up question, which is, what is the best advice that you have for physician owners and administrators who are considering these strategies?
I would think strategically, as we mentioned, about what is the problem you're trying to solve. Where is it that you are struggling to find employees? What departments are you seeing? Maybe even you weren't necessarily looking to hire someone per se, but if you have a lot of employees who are maybe the workload is just relentless, it's getting worse, we're stressed out, or maybe I think, if you have several people who are on leave, you can also look at some short-term solutions to help out. I think this is a great way to, like I said, help support your superstars and keep them happy. Like I said, I think just thinking strategically rather than just willy-nilly, we're going to replace a department.
Yeah, exactly. Well, a little more proactivity as ever is good when we have that luxury of time to think strategically and to do that. Wonderful. Well, Josie, thank you so much for being on today and for sharing your knowledge with us. And again, we'll get all of your contact information in the show notes and in the LinkedIn post. And we'll look forward to hearing more as we kind of boldly explore this new concept. So thank you again very much.
Thank you so much. It's a pleasure.
Great having you here. And I'll invite the audience to join us next week where we'll have another topic on medical money management.
Thank you.
You can find more information online at medicalmoneymatterspodcast.com, and you can sign up to be notified when enrollment opens for the Medical Money Matters e-learning program for a mini MBA physician style, which will carry CME credits and will be released in upcoming months. In that, we'll do an even deeper dive so you can understand dynamic budgeting strategies, cash flow forecasting, and other more esoteric financial concepts. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you and send you my heartfelt gratitude for all that you do for your patients all day, every day.